Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the disorders of penis and phymosis and circumcision. Phymosis is a condition may be due to congenital narrowing of the preputial orifice, usually associated with an unduly long foreskin. In extreme cases of congenital phymosis, while the patient passes urine, the prepuce balloons out and a thin stream of urine follows. If there is meatal atresia hidden under phymosis, may cause dysuria, residual urine, hydroureter and hydronephrosis. It may be acquired as a result of chronic or acute inflammation of the lining of prepuce. Treatment. The choice of treatment is the circumcision. In infants and children, by the request of the parents, may be religious or personal, like balanitis due to inability to retract the prepuce or long prepuce. A recurrent melanoposthitis and phymosis follows due to repeated attempts by the parents forcibly to retract the prepuce. In adults, due to inability to retract for intercourse, a tight frenum, balanitis, and sometimes before radiotherapy for carcinoma. Procedures in infants. Preparation of the patient. The part is washed with soap and water and painted with non-irritant antiseptic. The prepuce is retracted. If it is not possible, the preputial orifice is stretched with a hemostat in order that the postcoronal sulcus can be cleaned of smegma. A pair of sinus forceps or bone forceps is applied obliquely to the prepuce parallel to the corona, just beyond the tip of the penis. The skin distal to the forceps is excised with scissors close to the forceps, which are then removed. The other layer of the preputial skin retracts, leaving the glands covered by inner layer, which is divided in the middle line anteriorly by introducing a blade of delicate scissors between it and the gland. Each leaf of the deep layer of skin mucosa, leaving a narrow collar around the cornea. The frenal artery usually requires ligation as well as several small vessels on the dorsum. The cut edges of deep and superficial layers are approximated with fine catgut sutures. A wisp of cotton wool soaked in tincture benzoin makes an excellent waterproof dressing. It gets detached when the patient in a bath 6 days later. Circumcision. In adolescents and adults, the prepuce is retracted till its tense orifice is apparent or the tip of the glans comes into view. Onto the edge of prepuce are placed 3 hemostats, one in the midline ventrally and 2 on either side of the midline dorsally. The prepuce is then split in the midline dorsally to within ½ inch of the corona, the undersurface of the prepuce having been completely separated from the glans and the corona. The layers of each flap are excised, keeping ½ inch distal to the corona. The superficial layer is retracted and bleeding points are secured and ligated. The inner layer of prepuce having been trimmed to 1/8 of inch from the corona. The two cut edges are approximated accurately with fine interrupted catgut stitches. The cut edges in the immediate vicinity of the frenum can be neatly drawn together by mattress suture. The ends of the approximately placed stitches can be left long to anchor a circular dressing of ribbon two-leg grass. Paraphymosis. It is the swelling of glands and surrounding tissues due to the constriction of the phymosis ring after retraction and inability to return. Treatment. 1 ml of normal saline containing 150 turbidity units hyaluronidase is injected in each lateral aspect of the swollen ring or prepuce. 15 minutes later, the swelling is much reduced, and in early cases, the reduction can be accomplished with ease. Second type. If the above procedure is not successful, procedure is done under general anesthesia. The constricting band is incised, and the narrow cuff of skin which formed the constricting band is excised. Now there is no obstruction to reduction, and there remains only to remove a band of cuff of normal skin on the proximal side of the gap and unite the cut free edges, thus performing circumcision. That's all about the phymosis, paraphymosis and circumcision, and in the next video I will discuss about some other disease